Unit 2 gets us to start thinking about the concept of health literacy, which is an incredibly important and foundational term when it comes to health communication. Not only does this concept get us to think about how well we communicate when it comes to health issues, or how well we seek out, construct, and share information, but it also gets us to think about specific issues when it comes to literacy and your ability to read, write, and process information in general. Our friends at the U.S. Department of Health and Human Services offer this definition of health literacy: the ability to obtain, understand, and use health information to make informed health decisions. Now, there are a lot of important communication ideas that are tied up in this definition, so let's take a look at it line by line. The first part of the definition encourages us to think about the ability to obtain, understand, and use health information. So by focusing on the word ability, it encourages us to think about, do you have the capacity to read and write? Do you have the ability to engage in basic communication practices, such as obtaining and understanding information? Later on in the semester, we're going to explore the idea of self-efficacy. So not only do you have the ability to do these things, but do you actually perceive that ability in yourself? Do you know that you can engage in these types of communication activities? Next up, we have the ability to obtain, understand, and use information. These are basic communication seeking practices. Do you know where to go to get information? Are you able to work through that information and really grasp the concepts and grasp the instructions that the healthcare professional is sharing with you? And then finally, can you translate that information into something usable? Can you take a prescription and know how to follow the directions? Can you look at a nutrition plan and figure out how to translate that into your own daily eating practices? Next line, we focus on the idea of health information. And this should take you back to our basic definition of health communication. The idea is that we're focusing on the wide array of both facts and opinions when it comes to what it means to be healthy. So being health literate means that you can take a look at health information and make decisions about what is most important to you. And that takes us to the final line about making informed health decisions. A lot of health communication focuses on the idea of being evidence-based. So when we make our health decisions, we're not just pulling suggestions out of the air. Rather, we're making those decisions based off of solid research, solid recommendation, and a lot of health expertise. The concept of health literacy is important across many different types of health contexts. For example, health literacy is incredibly important when it comes to doctor-patient communication. When a doctor is attempting to explain to a patient a particular drug regimen that they have to follow, or a particular set of instructions that they might need to understand in order to take a drug or follow a particular healthcare prescription, the idea that that doctor knows the patient can follow that information and translate it into their daily practices is incredibly important. And so that doctor needs to assess, first of all, is the patient literate? Can they read, write, and understand information? But also, can they do that in the context of whatever health issue is that they're facing? Health literacy is also important when it comes to other health contexts. For example, many of you have probably seen a health campaign out there that encourages you to stop smoking, drink responsibly, don't text and drive. All of these campaigns are based off of a fundamental understanding of what the consumer can do. Are they able to process the information from that campaign? Are they able to follow the instructions that the campaign suggests? Are they able to understand the basic message that you're trying to share? When it comes to breaking health literacy down to its usable parts, a scholar named Nutbeam has come up with a definition of health literacy that focuses on three different levels. First, there is a basic or functional level of health literacy. This is the basic idea that you can read and understand information on a prescription, that you can follow a diet plan, that you have those basic skills in order to follow through on a particular health context. There's also a level of communicative or interactive health literacy. This means that you have the ability to explain to other people what you're doing. So, can you tell a child the particular prescription they're supposed to follow? Can you explain to a friend a diet regimen that you're following? And then finally, there's a level of critical health literacy. So not only can you follow the basic information, not only can you explain to other people what you are doing, but when it comes to critical health literacy, are you able to advocate for a particular health issue? Are you able to speak with legislators, friends and family members, experts, doctors, universities about some of the specific health information that people need to follow and the things that are important to you when it comes to health? Taken together, these three levels of health literacy give us a more complete picture of what it means to be able to obtain, understand, and use health information in order to make informed health decisions. It also gives us a more rich understanding of the different types of communication practices that are involved with a basic level of health literacy, an interactive level, and then finally a critical level. When it comes to measuring, determining, or assessing a person's level of health literacy, there are some basic ways to do this. When it comes to testing for a basic or functional level of health literacy, we have two key resources that we can use. And I've included links to both of these websites on the Blackboard site. The most popular test that we see when it comes to testing for health literacy is the test of functional health literacy in adults. This test is about a 66 question survey that doctors and nurses and other healthcare professionals can administer to a patient while they're in for a doctor visit. It takes about 18 to 20 minutes to administer, and healthcare professionals read a series of scenarios to their patient and ask them to complete some basic fill-in-the-blank sorts of questions. At the end of the test, the doctor or the nurse or the healthcare professional can have some level of confidence about whether or not their patient can read, interpret, and translate health information into daily practices. The big problem with this test is that it takes 18 to 20 minutes to administer, and who has an extra 18 to 20 minutes to take a survey during a doctor visit? As such, some other researchers developed a new tool called the Newest Vital Sign. This particular health assessment tool uses a nutrition facts label, one that's been designed for a pint of ice cream, in order to help determine whether or not their patient has the level of literacy required in order to follow basic health information. I will let you take a look at both the test of functional health literacy in adults as well as the Newest Vital Sign as an example of the types of ways that we can measure health information and health literacy. The test of functional health literacy in adults and the Newest Vital Sign are most useful when it comes to measuring a basic or functional level of health literacy. When it comes to the communicative and the critical levels, a lot of times we have to get more creative in assessing and measuring how well people have that level of literacy. Make sure that you keep these ideas in mind when it comes to your first activity prompt for Unit 2. I'm going to ask you to think about these three levels of health literacy in reaction to the activity that you carry out. Again, these ideas are not in the book, so you might want to make sure that you keep these slides and keep this lecture in mind when you're carrying out that activity prompt. Many times, we adapt the concept of health literacy to a more specific context. To provide you an example of health literacy in action, I'm going to share with you a poster that I put together with Anne-Marie Gloucester. She is formerly from the University of North Carolina at Greensboro in our nutrition department. When we did this project, she was actually the lead educator at the Edible Schoolyard at the Greensboro Children's Museum, and now she is a professor at App State in their food services department. Anne-Marie and I put together this idea of kitchen literacy because we realized that kitchen skills and cooking was becoming a bit of a lost art. people aren't very literate when it comes to cooking and kitchen skills. So we took Nutbeam's three concepts, and if you focus on this point in the middle of the poster, we came up with a definition and an example of both functional kitchen literacy, interactive kitchen literacy, and finally critical kitchen literacy. So when it comes to the functional side, it focuses on your ability to read, write, and evaluate basic cooking information. So can you identify cooking equipment? Do you know the difference between a knife and a spoon? But even more importantly, do you know the difference between a grater and other kitchen tools that are out there? Do you know how to read a recipe? Do you know how to write a basic menu? Can you read a nutrition label? This scales up a little bit when you start focusing on kitchen literacy from an interactive perspective. Are you able to translate recipes and rules into everyday eating practices? Are you able to plan a meal in order to maximize the health benefits? Are you able to explain cooking practices to others? And then finally, when it comes to critical kitchen literacy, it's all about cooking and communicating to improve food systems. Are you able to advocate for policy changes? Are you able to cook from scratch with local ingredients? Again, are you able to advocate in that larger sense for what you'd like to see when it comes to your own food system? We put this together because of a comment that I got from a university student at UNCG who said, I'd probably eat better if I actually knew how to cook. And so that idea of obtaining, processing, and translating kitchen information into actual eating practices is an incredibly important component when it comes to health communication. So this idea of kitchen literacy gives you an example of taking that notion of health literacy and adapting it to a more specific health context. Promoting kitchen literacy might look a little bit different from promoting cancer literacy or pregnancy literacy or any other health system that's out there. As you continue your work for Unit 2, Week 1, make sure that you keep these ideas of functional, interactive, and critical literacy in mind. Good luck with your assignments, and let me know if you have any questions.